Hi everyone. We are going to be demonstrating today the dental module in Tamanu. It's one of our more popular features in the countries where it's used. This is used in a couple of countries already. Like everything in Tamanu, it's very, very configurable. So all of the data fields you see, the drop-down lists, everything can be completely configured. As well as the workflow, you've got lots and lots of different options of how it actually gets applied. We'll be demonstrating the most common workflow that people use today, but you can jump around and play with that pretty substantially once we get into the planning phase for a deployment. So let's jump into it. I'm going to whip through some things today pretty quickly, but hopefully we can keep up. So the first thing with any dental encounter is the appointment. So we can come in here. Obviously, I should start by saying everything in here today is obviously demo data. None of these patients are real. None of the data is real. You can see here, this is our appointments for different departments. You can see today we've got 4 appointments in the dentist rooms. We've got a new feature actually, which is location bookings, if you want to get way more specific with bookings. So here you can see that I've booked in a patient to that specific room, the dental room 1 at 10 a.m. And nobody can book over the top of that, and you can see dental room 2 and so on. So you can book things really specifically. More commonly with dental bookings, people just use the outpatient appointments feature where you can book multiple people in to the same resource. So you can see here we've got 4 bookings this morning, and you can filter that. So if I just want to see dental appointments, I can filter it. So I'm just now seeing dental appointments, and I can also filter it by area. In the case of dental, it comes to the same thing. So the area, which is the physical location, is dentist rooms, and the type is dentists as well. Now you can see a couple of patients have arrived. Adrian there has already been seen. Betty has arrived, and so we can look at that with some color coding and know what's going on. And Austin Elliott is going to be the patient that we see today. We're going to mark him as arrived. Okay, and then we're going to check him in. So the dentist is going to go and see them now. Most dental appointments are a clinic appointment. You can also call that an outpatient appointment. You could call it a dental appointment if you like. That's one of the things that's configurable. So here we're going to say it's dental. The clinician will say, this is all just, as I say, fake data. We'll say test practitioner. The area is the dentist rooms, and we're going to bring him into dental room 1. Now, Tamanu has bed management, so you can see that both dental room 1 and dental room 2 are both available at the moment. If there was a patient in there, it would tell us that it wasn't available, which is a handy little feature. There's probably no referral source, patient type you don't need to enter for dental patients, and reason for encounter, we can just say dental checkup. All right, so now that starts the encounter for Austin Elliott. So we can go and see that encounter now. Okay, so the usually the admin staff or the receptionist or whoever's working out the front can start that encounter, and now the clinician can come in and see what that encounter looks like. So tasking you're probably not going to use for the dental department, but you might have cleaning as a task before they come in for their checkup. You can add tasks in there and you can assign them to different staff members. You're probably not going to record vitals. You could record notes against the patient if it was quite a substantial encounter. You may also record major procedures, so you can come into here and capture extractions or root canals. Anything like that can be captured against the encounter. Probably not going to be ordering labs for a dental encounter, but you might order a microbiology lab potentially. You would fairly frequently, you may want to order an imaging request. If you're not doing it in the dental chair and you need to send them off somewhere, you can come into here and order, for example, an X-ray of, not even sure, the mandible, I guess, the jawbone, and you could assess for fracture, or whatever the case may be. Now we'll come back and look at how we deal with imaging requests a little bit later on. Dentists may order medications. You might be ordering antibiotics or analgesics. You can order them from here. The main thing that we want to jump to though is forms. So with forms, we want to say new form, jump down to the dental department, and program forms is one of the most common tools in Tamanu. Now, when I select the program here, you can see there's a lot of noise here. There's a lot of different options. But because in Tamanu we've got very granular permissions, we can set that up so that the dental department can only see the dentistry program and they can only see dental forms. So it's not confusing. It's very, very obvious what to do. It's a really easy workflow. And you come into here. Now, we've just set up a couple of fake forms to capture data. In Kiribati, there are 6 different forms that the dentists can fill in depending on the procedure or the assessment that they can do. In Nauru, they just use 2 different forms. You can have as many as you like for really, really granular data capture or just broad data capture. So this is a slightly broader one where you can come in and knows who the patient is, obviously. And then you can say, was it an oral examination only? Did they get antibiotics? Did they get analgesics? And then you can answer things like, we did some preventative care, we did a minor extraction, and then there was some post-operative work. Did they have any treatment on procedures on deciduous or permanent teeth? We can just say permanent teeth. And then it goes through and asks you about the treatments that you provided. So what was the preventative treatment that you gave? Did you do scaling? Yeah, we did a full mouth. Oral hygiene instructions provided. Now, I should point out at this stage, I am not a dentist. I don't know what all of these things mean, so I'm probably not the best person to answer all of these questions. But you have all of the different question types that you would think of. Conditional visibility, numbers. We can do calculations in here. We can have resulted questions based on previous answers. Numeric. We can put acceptable values and decision support around numeric numbers, all those sorts of things. So we're going to skip through the rest of the questions just in the interest of time. Do all that and complete it. And you can see now that that form is submitted against that patient. And you can see that. Now the other type of form you can do is where you want to see previous answers. Okay, so we're doing a dental assessment. And I want to see what was the previous assessment like. Well, that's built into the form. So here we're using the FDI notation system and looking at each one of the teeth and the findings on the teeth. Immediately underneath, to help out, you've got that previous assessment. So we can say that it's still 2 millimeters. We can say that that's 2 millimeters. We can say that's grown to 2 millimeters. Small chip still present. We can say that that's grown to 4 millimeters, whatever. Now, again, I'm not going to go through and fill all of these in, but you can see for each tooth you can do that. You can use the tab button, so it's really, really easy to navigate between these fields. You can see all of those previous findings and enter your new findings and complete that. And if you want, you can make all those fields mandatory, so it's impossible to skip through them. Yeah, whatever you like. So you can do all of that. The other thing is attaching images. So there's 2 ways of attaching images in Tamanu, and it depends how it's configured in your setting. If you have an integration with your RISPACS, your radiology information system, the imaging request that you did earlier can automatically go to the imaging software and it can return the result back to Tamanu. So this would be returned back automatically. It would say completed and it would have the result, no fracture detected. It would also have a link that you could click on to actually see the image or show the patient or whatever the case may be. Now, we don't have that integration set up in this demo environment, but that's something that we can do in a live environment. And so that's one way of returning imaging results. If you don't have an integration with your imaging software, you can manually attach images that are returned from them. So in that case, you would come into here and you could say dental x-ray, choose that there, document owner, whoever the department is, and then you just go and choose the, so you've got to choose here, you choose your dental x-ray, and you go add. And once you've done that, so we've added that dental x-ray now, we can click on that and view it. Within Tamanu, you don't have to open up external software or anything like that. There's no limit to the number of images that you can attach. And whilst there is a file size limit, it's pretty big, and we can always increase your storage. So yeah, there's really no limit to the number of images that you can attach. We have a new feature coming up in Tamanu, which we expect to release around the middle of 2025, so 4 or 5 months away, where you'll be able to annotate directly onto images. So you'd be able to upload an image and then you'd be able to make notes directly onto that image. You'll also be able to pre-upload standard template images and then annotate onto those template images. So, for example, a map of all of the teeth in the mouth that you can use. Really, really cool. That's on its way. But for now, we can't annotate these in here, but you could make annotations externally and then re-import them. Now, if we decide that this patient is going to be an ongoing patient, or they need ongoing care, or you may just want to do this with all dentistry patients, you can add them to something called the program registry. So we're going to come into here and select the dental unit registry. And you can do statuses in here. So you can say, for example, that this patient needs major treatment. You can say what are the related conditions that they have and submit that. And the advantage of this is that you don't need to just come back and find this patient and then look at all their previous encounters. Now we can go to the program registry, look at the dental unit program registry, and it will list all of the patients who are part of the dental registry. Now I'm going to add a couple more patients so that you can see exactly what I'm talking about there. We're just going to add 2 or 3, we'll say, add them as quickly as we can. Just add these 2, dental unit, active monitoring, and we'll say periodontitis. Okay, so we've been adding patients to the dental registry, and it's just a really, really good way of managing what we call patient cohorts. So you can see all of these patients are now, if you like, dental patients that require some sort of ongoing care. You don't need to add patients to the dental program registry, but it is a really handy way of organizing patients. So now, for example, if I want to see patients who have gingivitis, I can search and it will filter that list just to show me the patients that have got gingivitis. If you want to see patients that we wanted to do active monitoring on, it will sort by them. And you can have thousands of patients in this register so that these filter fields become a really, really useful way of managing those patient cohorts, finding patients that are supposed to be under active monitoring but have been lost to follow-up potentially, or a list of patients who are awaiting major treatment so that you can organise them better. Say you've got a specialist surgeon coming in and you wanted to organise those patients in one place. So really, really useful. This is the patient we were dealing with, Austin Elliott. You can come in and see a dashboard of his dental care. Every single program form for dentistry that's ever been collected against Austin is available to view here. So we don't need to go back through and search and find every individual encounter. They're all in the one place, which is another advantage of the program registry. And you've got this really handy dashboard to see his status, to see related conditions that he may have. And if you like, you can enter more data against the patient without even opening a new encounter, although we do suggest that you try and open an encounter so that it's a little bit easier to track. In terms of documents that you can attach, you're not limited to just images. You can attach external reports, referrals from outside care providers. All that sort of stuff can be attached to the encounter as well. It's also got an invoicing module where you can, we won't go through the invoicing module because it's its whole thing, and probably demonstrate on that for 20 minutes as well. But you can generate invoices automatically based on the procedures, the labs, the imaging that has been done, and generate that automatically. So really, really useful, hopefully simple to use. This is a really, really quick run through of it, but of course there's so much more you can do with the dental module, and different ways you can set up those workflows to suit the local setting. Hopefully this has been useful, but of course if you've got any questions, feel free to get in touch.